Hello everybody, welcome to my another video, and I hope you're doing well. So today
There are
let's go
three
on with
scenarios
our next
in which you
topic,
can
that is
see
on disturbances of
disturbances
number
in the number
in
of
dentition.
dentition.
Okay,
Either it can be anodontia, hypodontia, or oligodontia, and it can be supernumerary teeth, or you can say hyperdontia.
so supernumerary we will discuss about it in our next video, but in this video today we're going to talk detail about anodontia and hypodontia and oligodontia.
So our first topic is
What is
anodontia.
anodontia?
It is a state, a condition in which there is a complete absence of primary and permanent teeth, meaning not even a single tooth is present within your oral cavity. It's completely absent. So the most common cause is a genetic disorder called ectodermal dysplasia. This is a genetic disorder that affects the skin, the nervous system, the glands, okay, and also it affects the development of the teeth, okay, that lead to either hyperdontia, but in very rare cases it can lead to anodontia as well. So here's a picture showing a patient with complete absence of teeth, or you can say the patient is suffering from anodontia. The next topic is hypodontia or oligodontia. Both of them, the term, they resemble each other, but they are differentiated based on the number of the teeth that is absent. So we're going to talk about what is hypodontia. Hypodontia is basically a congenital absence of 1 to 6 teeth excluding the third molar. So this is hypodontia. Oligodontia means congenital absence of more than 6 teeth excluding the third molar. So this is called as oligodontia. This is an example of hypodontia. Take a look at the picture and you will find out that there is only 2 teeth missing. And it is the upper lateral incisor, both side, okay? This is an example of oligodontia. Here you can see that more than 6 teeth is absent, but there are few teeth present, like few molars you can see. So you will not say this is an anodontia, rather you will say oligodontia. So if the teeth are missing and the number is more than 6 in numbers, okay, they are called as oligodontia. Now there are many causes that can lead to hypodontia, oligodontia, anodontia, okay? So few examples are like environmental factor. These include jaw fracture. It may be extraction, surgery. It may be radiation, radiotherapy, a radiation, an ionizing radiation, okay, that has been applied onto that developing tooth bud, okay, that disturb and destroy its development phase and leads to absence of teeth. It may be because of chemotherapy, or it may be because of maternal smoking. When the mother is having a child, she's pregnant and she's a heavy smoker, she's taken smoking, or it may be because of some drugs she's taken, okay, that can affect the child dental development and can lead to hypodontia, oligodontia, or anodontia. It may be because of disease that is present within the child. It may be ectodermal dysplasia, Down syndrome, cleft lip and palate, or it may be idiopathic hypoparathyroidism or pseudo-hypoparathyroidism, or it may be because of rubella infection. Genetic mutation, there's a research about it, and they have found that there are few genes that if there is a mutation within it, okay, they can lead to decrease or disturbances in the number of dentition. So number one is MXS1, XN2, PAX9, and EDA. So these are 4 most common examples of genes whose mutation can lead to oligodontia and hypodontia. So common missing teeth in the oral cavity is, we know third molar is the most common teeth to be missing, but beside it, the most common teeth that are missing is maxillary lateral incisor and the mandibular second premolar. Okay,
This one we're talking about the permanent dentition. And primary dentition, it's variable. It depends, okay?
So, what are the consequences of a missing teeth? It depends on the number. The greater the number of the teeth, the greater the consequences. So, it can affect the speech, it can have a negative effect on the chewing and masticatory activity, and the most important, it can affect and compromise the aesthetics of the patient. So, there are various treatment options, okay? It depends on the number of the teeth missing and the scenario, the condition of the patient. So the first option that we're going to discuss is about implants. You can either use implants in order to replace the missing few teeth, or if the missing teeth is one or two, you can sometimes transplant a teeth. Okay, you can transplant the teeth from one socket to the another socket, okay, and then after that you can reshape it using a handpiece and with specific burrs, or using a composite restoration. Okay, you can reshape the teeth, okay, into the teeth that you want to make it resemble, okay, or you can use a denture, either partial or complete denture. Partial denture for hypodontia, oligodontia, and complete denture you can use for anodontia. And sometimes we can make bridges. And in orthodontic cases, okay, we can see that if those teeth is not required because of discrepancy in the space available for the teeth, so sometimes the orthodontists, they can recommend the patient to undergo a brace therapy. Okay, they will use braces in order to align the teeth and to close those spaces. Okay, and it depends on the scenario. Either the patient require a denture implants, or we just can accept those space and close the space using orthodontic treatment like braces. And these are various options, so it depends on the scenario, it depends on the budget of the patient, it depends on the dentist's perception, his clinical decision, and there are various scenarios